So the AT Still University looked at all the factors: number of dentists, distribution of dentists around the state, the need within the city of St. Louis, and the fact that St. Louis had the patient population that our students could help. And it seemed like a natural fit. So the school is designed such that, as Dr. McManus mentioned, the first 2 years we've done Kirksville, and that's where the dental students will do their preclinical, their didactic, and their simulation lab training. And at the end of the second year, the students will move to St. Louis. They'll do their entire third year here in St. Louis, and during their third and fourth years, they will be treating a wide diversity of populations, but most importantly, they'll be reaching out to underserved populations who need help with their oral health care. So the entire third year will be here in St. Louis, and then during the fourth year, the students do rotations around the state. Once again, we're trying to make a maximum impact across the state of Missouri as far as increasing the oral health status of the citizens of the state. So on this document that Dr. McManus handed out, you can read through some of these bullets here, but the first bullet on the first page just highlights the fact that Missouri does rank towards the bottom in all 50 states as far as access for oral health. And we're partnering with Grace Hill Health Centers, which is the largest federally qualified health center group within the state of Missouri. It's a very well-established group that reaches out to all sorts of populations within the city of St. Louis and around St. Louis. So Grace Hill will be partnering with us in the operation of this dental school, the clinical portion. We like this area here. Quite frankly, this is a great area, we feel. It's a wonderful neighborhood. We've been very fortunate in being able to secure the piece of land off to the north of us here. This will be a great location for the training program. Amongst other things, there's availability of housing and commerce within the area that the students would very much enjoy. It's also great access to transportation. This area is right near the intersection of 44 and 55. There's also great public transportation on Truman Parkway. So it's a variety of factors. It's just a great overall location, very attractive. The fact that it does offer public transportation for the students, if they choose not to drive, they can ride a bus into the school in the daytime. And we'll be reaching out to populations that really, really will benefit from the health care that we provide. Thanks. We have 42 students in our first class. First class started on October 1st. It's really a great group of individuals. I am very much encouraged about the future of the dental profession looking at this class of 42 students. They're very altruistic. They're very community-centric. Just very kind people. The university, amongst the selection criteria that we utilize, of course we look at strong grades from undergraduate students, and of course we look at strong scores on their dental aptitude testing. But most importantly, the university places a high priority on community service. And we prioritize the placement of students into our class, students who have a long and demonstrated history of volunteerism and community service. So this is a really great group. They're very, like I said before, they're very much community-centric. They're focused on helping their communities. They're just real nice individuals. Quite frankly, I feel they stand out amongst dental students across the country. Some dental schools have students that are very competitive and very much into going to dental school because they want to have a very lucrative career in dentistry. I would have to characterize our first class in Kirksville, once again, as being very, very altruistic and very much interested in making a positive impact on the people that they treat. We have 42 students per class. We've already accepted, we've sent out 38 offers to the applicants for next year's class. That will start in July of this 2014. So starting in July, we'll have a total of 84 dental students in Kirksville. The class size will be 42 for the time being. Once we graduate our first class, the university will examine whether we want to increase the class size. What else can I tell you? Where are they from? Most of the students in the first class are from the Midwest. We have about 20-21% of the class is from the state of Missouri. Our goal for future classes is to increase that number of Missouri residents in the school as high a number as possible. Thought being that we want to bring folks in from Missouri to go to dental school here, and our hope is that these graduates, when they graduate from dental school, will return or stay within the state of Missouri and make a strong and positive impact on those access challenges that the state experiences. So the first class, about 21% of the students are from Missouri. So far for the second class, when we'll start in July, I believe the number is about 26-27% so far from the state of Missouri. A vast majority of the 42 students in the first class are from the Midwest. We have quite a few students from Illinois, a couple students from Kansas, one student from Iowa, a couple from Nebraska, one or two from Arkansas. So by and large, the students are from the Midwest.
And would you care to mention something about the volume of students that are applying? Sure. And we're not scraping the bottom of the barrel to get started.
Yeah, we are not scraping the bottom of the barrel. If you look at their test scores, and if you look at the grade point averages, these students are very bright individuals. For the next class, once again, we have 42 positions for the class that starts July 2014. We've had almost 1,100 applicants for those 42 slots. The number of applicants for the second class is up 13% over the number of applicants we had for the first class. I fully anticipate, as the school becomes better known, that the number of applicants we have will increase. Our sister school in Arizona receives a couple thousand applicants for positions there. They have 72 per class. So I have a good-natured competition with the dean of the dental school in Arizona. So we're going to see if we can boost our number of applicants up to compete with him, because he's doing great things at that school, and we're going to likewise do. But the bottom line is, the Arizona campus has become very popular, not because of the location, but because it's a community-centric dental school, much in the same way that the Missouri School of Dentistry and Oral Health is. I'm fully confident once folks really hear about the school, we're going to get huge numbers of people applying.
What is tuition?
Tuition is about $58,000 per year. Yeah, it's a private school, and that's not on the high end of the private schools. We're right pretty much in the middle of the road for private dental schools.
Yeah, we try to position all of our tuitions to be about the middle of the pack. I mean, that's our marketing decision in terms of trying to develop a niche.
And one of the successes we had last week was we were able to reverse a policy within the Health Resources and Service Administration National Health Service Corps, so that our students that are currently on campus in Kirksville are eligible for the National Health Service Corps scholarship. If the students receive the scholarship, they would do their payback by returning to hard-to-fill locations. Once again,
I was just going to say that it'd be hard to pay that back working in underserved locations like this. Yeah.
But to be honest with you, there are opportunities to work in underserved populations. I did a 25-year career with the U.S. Public Health Service, exclusively serving underserved populations. So the opportunities are out there. But the nice thing about this scholarship decision is that it's going to maximize our chance of the graduates staying within the state of Missouri once they finish school. And once again, that's our overall goal, is to increase the number of dentists in the state, improve the overall health status within the state. And like I said, I was in public health for 25 years. This type of dental school is exactly the type of dental school that the federal government and my colleagues in public health always wanted to see happen. The Arizona school has been producing dentists for several years now, but besides the Arizona campus, aren't too many schools that are public health centric, completely public health centric. This school will do our best to try to increase the workforce of dentists serving underserved populations, and I think it's going to put not only Kirksville, but I think it's going to put this neighborhood on the map, in that this is going to be known as the location that really turned around the type of dentists that are being produced, and for producing dentists that really reach out to the populations that need help.